Hi, I'm Shirley. Hi, I'm Monica, and we're here to talk to you about Graston.
So what is Graston? Graston is a form of manual therapy, also known as IASTM, which stands for Instrument Assisted Soft Tissue Mobilization. So Graston has done research showing that the microtrauma from these tools actually helps stimulate the inflammatory phase, which helps the tissues heal faster. So we're going to take a look at what the instruments do underneath the skin.
Between the skin and muscle, there's a layer of fibrous connective tissue called fascia. The fascial layer is a sheet of connective tissue fibers composed primarily of collagen that forms beneath the skin to stabilize and anchor muscles and other internal structures. In a healthy system, the muscle will slide and move without restriction. When a muscle becomes injured, the rate of collagen product by local fibroblasts is increased. The fascia becomes extra dense and fascial adhesions are created. Overproduction of fascial adhesions can affect mobility of corresponding muscles and joints. Instrument-assisted soft tissue mobilization, or IASTM, makes use of special instruments to help release or loosen fascial adhesions. The specifically beveled treatment edges are able to tug, stretch, and release superficial fascial adhesions. In addition to fascial mobilization, IASTM works on a neurological level by eliciting neural pathways and reflexes that affect muscle tone and mobility.
Let's talk about parameters for Graston. Parameter is patient position, which can either be supine, prone, or in a sitting position. Another parameter is duration, and they'll typically do it for about a few minutes. And the frequency will be about 3 to 4 times a week, depending on the extent of the injury. The more serious an injury is, or more chronic, you're going to do it more often versus a smaller injury. And you also want to make sure that you clean the tools after you use them, because you don't want to be spreading germs.
Now let's take a brief look at different Graston tools. Large handlebar is designed to treat large muscle groups. It's perfect for hamstrings, IT band, back, and shoulders. Small multi-curve tool is best for treating small muscle groups and joints, such as fingers, hands, and feet. Scanner is used in the beginning of the treatment to scan a broad area and find tight knots in the muscles. Tongue depressor has 2 edges that can be used to treat specific muscle and joints. And lastly, boomerang is perfect for aggressive treatment on specific muscle.
So the advantages and disadvantages of Graston are pretty simple. Advantages is that it's a quick treatment and it comes with different tools for different body parts. Disadvantages, however, is that it's very uncomfortable for the patient, but also that it can be expensive. You have to pay for the class to be certified as well as the tools.
Let's talk about conditions that we can treat with Graston techniques. IT band syndrome, carpal tunnel syndrome, sprains, strains, bursitis, back pain, neck pain, and myofascia restrictions. Here are indications of Graston: limited range of motion, pain during range of motion, muscle recruitment issues, and motor control issues. Here are some contraindications that you will never use Graston techniques. First, if I have compromised tissue integrity such as open wound, tumor, or infection. Second, if I have an active implant such as pacemaker. And third, if I have deep vein thrombosis, that means there are blood clots in the lower extremities of the body. Graston might mobilize the blood clots so that they could travel to the lungs, blocking the bloodstream. Lastly, never use Graston over the carotid sinus. That is a reflex area of the carotid artery, which regulates the blood pressure from external conditions.
Now we're going to go see this technique in action. Let's go meet the athletes.
Warning, you must be certified to implement this kind of torture. Treatment. Terry instructs Shirley to lie on her side so that she can access the IT band. She then stands in front of the athlete to get in proper position for the treatment.
Terry applies lubricant to the area. And since she is certified, she is able to first scan the area with her hand before using the scanning tool. The purpose of scanning is to find the adhesion that is problematic. Then she selects a more specific tool for the job. Since the IT band is a large area, Terry selects the handlebar tool. She begins going up and down the IT band and also treats a little of the hamstring and quad. Terry then rescans to see if the adhesions have shrunk. Terry is also careful not to go over the bony prominences. Terry instructs Shirley to lay on her stomach and puts a pillow under her ankles to obtain a more comfortable position. She then applies lubricant to the area. Terry begins scanning from the calcaneus all the way up the calf.
That's ugly.
Terry chooses the boomerang tool to fit the shape of the calf. Treating the calf treats the cause of Achilles tendonitis versus just treating the symptoms. However, you can use Graston on the Achilles itself. Terry chooses the tongue depressor tool for this area due to its smaller size. Because the tendon is very superficial, it gets good blood flow.
Well, obviously.
Terry may also treat the bottom of the foot because plantar fascia also attaches at the calcaneus.
Monica complained of neck pain and her trapezius was very tight. Terry used the scanner tool to scan the entire trapezius first. Then she asked Monica to sit on her right hand and tilt her head to the left. That put Monica's neck in a stretched position, which was best for treatment. In addition, if using Graston on a girl's trapezius, it is ideal that she doesn't have a sports bra on. After scanning, Terry found a knot in Monica's trapezius. She switched her tool to tongue depressor because it gave a better edge to pinpoint the specific knot. She stopped the treatment when bruising was formed. The bruising caused by Graston is called petechia.
Few moments later.
Due to microtrauma, bruising is normal, but when you reach petechia, it's a good place to stop the treatment.
That's Graston, guys. Thanks for watching. Hook 'em. Here we go. Again.
What?
Is it recording?
Now it's recording. Okay. And then twice. Oh, Monica.
Yeah, now it is. Okay.
Okay.
All right, we'll crop it. All right.
All right.
All right, go.
Thanks for.